Welcome back to Western New York Living. This morning, we're taking a little extra time to focus on women's health, more specifically breast care and some simple steps people can take to help prevent breast cancer. One of the best advancements over the past few years is to better understand any type of cancer is genetic testing. I recently stopped by Winsong Radiology to get an overview of how genetic counseling and testing can help many individuals assess their risks and treatment options for cancer. Plenty of people may not be aware that most cancers are usually caused by gene mutations. Somatic mutations may arise as a natural consequence of aging. A different type of mutation called hereditary mutation is usually inherited from one or both of the person's parents. Laura Fisher is Associate Director of Genetic Counseling at Winsong Health and has seen an upswing in recent years of individuals and families seeking professional genetic testing and counseling for very good reason.
A lot of the online tests have significant limitations that patients don't understand. There can be good online material, but sometimes patients either don't read it or don't understand it. So they may benefit from a consult with a genetic counselor to help explain those online test results if they have done that testing. They can also come to see me for a much more detailed test or to confirm any test results that they received online because they're not necessarily the same quality as what we offer here at Winsong. So genetic counseling is really taking complex information and making it easy for a patient to understand. So we want to make sure that patients understand their risk for genetic disease. So when I meet with a patient, we review their medical history, family history, and then we talk about the benefits and limitations of genetic testing because testing isn't right for everyone. So it's figuring out how much information does a patient want and who's really the best person in the family to test. Sometimes it's a detailed conversation that leads patients to speak with their family members as well. We know that there's a lot of patients out there who have never heard of genetic testing before. They may not know that this is a service that's available. So hopefully as primary care physicians continue to ask patients about their family history and refer those patients, more and more people will learn that they could benefit from genetic counseling and testing.
Taking a genetic test is very simple and results from the testing are normally available in about 3 weeks' time. Typically, insurance covers consultations with a genetic counselor the same as a visit to any other specialist. The information provided by the genetic test not only benefits the individual tested, it can also benefit other family members.
Once we find a gene mutation in a family, it often means that that person's children and siblings have a 50% risk to have the same gene mutation. We then want to make sure they're sharing it with other relatives, aunts, uncles, cousins, really anyone in the family might also be at risk. So we do encourage them to share it with as many family members as they can. So the best person in the family to test is always going to be the person who's been affected with cancer. So that's usually where we like to start. That's not always possible. Sometimes those people with cancer have passed away or may not be available for testing, but that's our primary goal. But a lot of patients, come to me because of their personal or family history of perhaps a young cancer, like a breast cancer diagnosed at 45 or younger, any rare types of cancer like ovarian cancer or male breast cancer, and 3 or more family members with the same or related types of cancer. So those would all be good reasons to meet with a genetic counselor. So I arm my patients with lots of information moving forward. So once they get the result, which they do always get a copy of the results, that includes a letter that I write that summarizes all of the recommendations. That letter also gets sent to their doctors so that their doctors can be on the same page and make sure they're the ones that are really implementing those guidelines or the recommendations that I've made based on that gene. I think what makes me really just passionate about it is because I can see how it affects a whole family and how we can really catch cancers early or prevent them altogether.
To find out more about genetic testing and counseling at Winsong Radiology, you can head over to their website, which is winsongwny.com. This is a great way to find guidance and support on inherited diseases and conditions. Everyone is also invited to a community lecture Laura will be holding on October 8th at the Breast Cancer Network of Western New York location on the screen.